Good evening. My name is Phillip Stephens, and I'm a Board Certified Clinical Chaplain through the College of Pastoral, Supervision, and Psychotherapy. Tonight, I'd like to provide you with some information about hospital chaplaincy. Together, we'll look at the purpose, the people served, and the practice itself. Let's start off talking about the purpose of hospital chaplaincy. A chaplain is an individual who provides religious services, pastoral care, and spiritual support to people in settings outside of the church, the synagogue, or the temple. This ministry includes people who are hospitalized, incarcerated, or unable to attend religious services because they are on military duty. Chaplains provide pastoral care and spiritual support. There are several tasks and expectations for all chaplains, no matter where they serve. A hospital chaplain, as you might have guessed, provides pastoral care and spiritual support in the hospital setting. This ministry includes conducting a pastoral assessment of a patient's spiritual and emotional status, documenting that assessment in the appropriate medical chart, and devising a plan of care which will help meet the patient's spiritual needs. The spiritual plan of care needs to be one that supports and one that is aligned with the medical treatment the patient is receiving in the hospital. Chaplains are frequently asked to provide specific religious duties and offer sacraments relevant to the faith practices of the chaplain. And because chaplains provide support and care to people of all faith backgrounds, sometimes the chaplain will need to bring in a clergy member from the local community who can provide the appropriate sacraments based on the patient's religious and spiritual beliefs. Providing pastoral care and spiritual support is the primary purpose and focus of a hospital chaplain. Now let's talk about the people served. There are three primary groups of people the chaplain serves in the hospital setting: the patient's family, and the hospital staff. And certainly when someone thinks of hospital chaplaincy, the first thing they may think of has to do with the ministry provided to the patients in the hospital. And serving the patients is indeed a large part of the ministry. People come to the hospital for medical care, and that care might be necessary due to a sudden illness, due to a disease, an accident, or some routine medical procedure that the patient is undergoing. But even if a person is staying in the hospital due to a routine medical procedure, there's nothing routine about going to the hospital. In fact, going to the hospital disrupts our routines. Going to the hospital is a change from our normal day-to-day activities. And people do not like disruption. People do not like change. So for that reason, even just going to the hospital for something that we might consider to be a simple routine procedure can be very stressful. And stress can wear a person down. Stress can negatively impact them emotionally, mentally, spiritually, and certainly physically. When we're under stress, our bodies do not heal well. So it's important that we find some way to mitigate the stress of being in the hospital. The chaplain can help a patient recognize and manage their stress. Chaplains can also provide a healing presence simply by visiting a patient and saying hello. The responses a chaplain receives from patients can vary quite a great deal. Some patients just love to have a visit from the chaplain. Some patients are going to want to talk to you. They're going to want to share their story with you. Some patients are going to want to confide in you and tell you about their fears, their worries, and their concerns. They will share with you things that they don't want their families to know about. They don't want their family to think that they're scared. They don't want their family to think that they are concerned about what might happen to their family if they don't make it through this surgery. Patients will love to talk to you sometimes. Now, some patients are going to ask you to help them process what the doctors and nurses have told them. They get confused sometimes. There's so much information coming in at them at one time that they just have to have somebody there who can help them kind of wade through it a little bit. They'll have questions like, what does their prognosis mean? What's the expected outcome of the surgery? What will the recovery process look like? And while you'll not be able to give them medical advice, and while you certainly won't be able to answer all their questions, you will be able to help facilitate some additional conversations between them and their nurses and their doctors and their treatment team so that the patient can gain more clarity and a better understanding of what to expect. Some patients are going to want you to help break some sad news to their family. They've learned that they're terminally ill. They've learned that they're not expected to live another 6 months. And while they need you to help them process it, they also need you to be there and be present and lead and guide the conversation that they're going to have with their family. They want you there to pray for them. They want you there to pray for their family. They want you there to be a support system for them. Sometimes you're going to want to visit with a patient and that patient will not feel well enough to talk. Their level of energy is too low. Their level of pain is too high. And as you come into their room, they'll just smile and gently whisper, "Thanks for coming, but I don't need anything right now." And then there will be some times when you knock on a door to go see a patient. You poke your head in the room, you smile and you say, "Hey, I'm the chaplain." And before you can say anything else, the patient is going to point their finger at you and say, "Get out of my room." When that happens, and it will happen, don't get upset. Patients have people coming into the room all hours of the day to take vital signs, to give them medicines, to give them shots, and you are the only one that they can kick out. And when they kick you out, you can rest assured that you have helped that patient express a sense of agency. You made their day. They're going to have a great story to tell somebody about how they ran that chaplain out of their room. You'll interact very regularly with patients. It will make up a large part of the ministry that you provide in that setting. During good times, during bad times, you'll sit with patients. You'll listen to them. You'll laugh with them, and you'll cry with them. You'll also interact not only with the patients, but with their families. Some patients' families are very involved in the patient's care. And some families don't communicate well with other members of the family. The chaplain can be a vital part of facilitating communication in these situations. You may need to help arrange meetings and conversations with the doctors and the nurses so that the family better understands the condition of the patient and the treatment that they're going to be receiving. You may need to help the family and the patient complete forms like a medical power of attorney and do not resuscitate forms, forms that discuss what the patient's wishes are in case things take a very bad turn. You may need to sit with them, visit with them, and answer questions as they make tough decisions about end-of-life care and withdrawing life support treatments. You may need to facilitate some conversations and some attempts at reconciliation between the patient and their family, or even between family members who do not see eye to eye on the medical treatment and end-of-life decisions the patients previously made, decisions that the family does not agree with. You will need to be present with family members as life support is withdrawn from someone they love. You will stand with them, wait with them in the room as their loved one passes away. You will provide care and comfort to family members who don't know how to say goodbye. You will console family members who miss their opportunity to say goodbye. And you'll be there holding hands with those who experience a whole range of emotions in regard to their loved ones passing. You will interact a lot with the families of your patients. You'll sit with them, listen to them, laugh with them, and you will cry with them. Not only will you serve patients and the patients' families, you will also serve the hospital staff. You'll attend interdisciplinary meetings and you'll talk about patient care. You'll learn some new vocabulary as you quickly Google and try to figure out exactly what kind of operation it is that this person's going to have. And as you sit through those meetings, you will help devise plans of care for the patients that will facilitate their well-being, plans that will facilitate their recovery, plans that will strengthen them and encourage them and support them as they go through the treatment and recovery process. But the greatest interaction that you will have with the staff will not just be the interdisciplinary meetings, but the interaction that you will have with them that will make the greatest impact, in my opinion, is providing them with pastoral care and spiritual support. I always think of the staff of the hospital as the faithful congregation. And what I mean by that is patients and their families, they come and go. Oh, sure, you'll see some of them from time to time on a regular basis as they come in for some kind of dialysis or regular treatment. But for the most part, you will meet new patients and new families every week. They are like the visitors at a church. You want them to know that they're cared for. You want them to know that they're cared about. You want them to feel loved. But at the same time as you are reaching out to them, caring for them, you know that you may or may not see them again. But the staff, they are like the faithful churchgoers who show up every week. They are your congregation. They are your flock. They are your sheep and you are their shepherd. You spend more time with them than you do anyone else. You'll get to build in-depth relationships with them. You'll learn about their families. You'll learn about their fears. You'll learn about their hobbies, the things they like to do and the things they don't like to do. And at work, you'll be their sounding board. You'll be their confidant. You're the one that will help them process the stress, the pain, and the heartache that they witness on a daily basis there in the hospital. You're the one who'll support them and encourage them during weeks where they are understaffed, underappreciated, and overworked. You are the one they will look to when their first patient dies. You are the one who will be a safe place, a person with whom they can vent their frustrations, a person to whom they can share all their upset thoughts and all their harsh words for the insensitivity that they see some family member showing to one of their patients. You are the one who will help them to cling to the anchors of their faith when work is hard, when life is hard, when marriages are having a tough time, when their kids are acting up, or when they face the loss of a loved one in their own family. You'll spend a lot of time with the hospital staff. During good times, during bad times, you will sit with them, you will listen to them, you will laugh with them, and you will cry with them. You will serve patients, families, and hospital staff. Now, let's talk about some practical considerations for a hospital chaplain. One thing that I would suggest as a hospital chaplain is that you leave your agenda at home. That's an area that's always a topic in the interview for a chaplain position. Interviews always center on the chaplain or the candidate's ability to work with people who do not share their faith. As a chaplain, you need to be able to provide pastoral care and spiritual support to people who share your faith and people who don't share your faith. You'll need to be able to provide pastoral care and spiritual support to people who you really appreciate them, you like them, you get along real well with them, and you'll need to be able to provide pastoral care and spiritual support to people that you don't care for so much, people who don't share your beliefs, people who have some harsh opinions and who do some things and act some ways that you really don't appreciate at all. And whether you like them, don't like them, whether you appreciate the way they act or don't appreciate the way they act, you will need to be present for them, present with them, not pushing any sort of religious agenda, not looking to make converts, not looking to make friends, but just looking to be there present with them, meeting their needs. Oftentimes in clinical pastoral education, you'll hear someone speak about a ministry of presence. A chaplain needs to be present with other people, meeting the person served where they are without seeking to fulfill the chaplain's personal agenda. Good chaplaincy is person-centered. The person the chaplain serves is the one who sets the pace. Chaplains don't try to convert people. Chaplains don't try to fix people. The biggest part of our ministry is often just being a caring presence, being there with them, sitting with someone in the midst of their despair, sitting with someone in the midst of their grief, being present while they process all these different emotions and this overwhelming amount of information that they have received in the past week. We are to leave our agendas at home. Another practical consideration for chaplains is you must have a good ability to listen. That's the most important skill you can have as a chaplain, the ability to actively listen to the people you serve, whether it be the patient's family, or the hospital staff. You are the one who offers a listening ear and a non-judgmental, caring presence to everyone. Listening is the most important practice you can engage in as a chaplain. If you are a very outgoing person who loves to tell stories, listening might be a skill you have to really work on. I'm the kind of person that I love to tell stories. I love to interact with other people. I love to build rapport with them, connect with them. And when I first started studying to be a chaplain, I noticed that if someone told a story that I could really relate to, it raised a lot of my own stories in my mind, a lot of my own memories, a lot of my own experiences. And I looked forward to sharing those stories, those experiences with that person too. If the patient told me a story about how much pain they were in, and they compared it to the pain of a kidney stone that they had many years ago, I would be tempted to tell them about my own experience with kidney stones. I would be wanting just to share with them how many I've had and what was the worst one and how did I get through it. And I found that if I'm not mindful of the interaction taking place, if I'm not mindful of where the conversation is going when I'm with a patient, sometimes the interaction can change quickly, and our conversation now becomes centered on me, my story, and my experience. And when the conversation becomes all about me, my story, and my experience, I'm no longer being person-centered. I'm no longer listening to the person that I'm there to serve. I'm not listening to them. Now I find that they are listening to me. We have to be mindful of those threads that go on in our mind. We have to be mindful of our own experiences, which might crop up and which could cause us to allow the conversation to get off track. Listening is a very important skill. It's one we need to constantly practice as a chaplain. Not only is listening important, but another practical consideration when it comes to hospital chaplaincy is the time frame in which you work. Late hours are a big part of the job. Hospitals have a great need to have chaplains available at any time, day or night. Believe it or not, traumas, emergencies, accidents, and deaths do not just occur between 9 a.m. and 5 p.m. Chaplains will be called on, called to serve, called to be present, called to be at their best at all hours of the day. You'll need to be ready to get up, get out of bed in the middle of the night, and go and give your full attention to someone else, even though you didn't get a full night's sleep. And while you're there at the hospital, you don't want to just run back home after the emergency is taken care of, because if you want to build relationships with the staff who work the night shift, you'll need to visit them during that time. And not just on those nights when there's an emergency. You'll need to check in on them at other times as well, because that's how you'll build relationships with them. That's how you'll learn about them and their families and their likes and their dislikes. That's how you'll learn about what they are experiencing and what they're going through and how are they doing processing the demands of the job. Being present at various times of the day, that's how you will minister to those people who work those late night shifts. That's how you'll strengthen them. That's how you'll encourage them. That's how you will help them to be at their best so they can provide the highest level of care to the people they serve. Talked about the purpose, the people served, the practical considerations. Let me close by pointing out one more thing. There are some perks to being a hospital chaplain. There are perks to being a chaplain that serves in any institution, any facility, any capacity. But among all those perks, let me say one of them is not the fact that you'll get rich. You won't get rich being a chaplain, at least not in the monetary sense, but you will be rich in many other ways. You will be an important part of the healing process. You will be an important part of a team that provides medical care and direction for patients. You will be an important part of a team that helps people during some of the most difficult times in their lives. You'll serve alongside some wonderful, caring people. You will make some lifelong friendships. You'll be called into some rooms where the moments and the times are very tense. And even in those dark and difficult times, even in those moments of tension, you will share some sacred space with others. You will share some time with patients, their families, and the hospital staff that are just incredibly moving, incredibly memorable. You will help people. You will care for people. And you will strengthen people as they go through some of the most difficult and toughest times in their lives. You'll be present to see healing take place in people's bodies, in people's families, and in their spirit. But I would tell you that the biggest perk of being a chaplain is that it is always a blessing to serve others. It's always a blessing to be able to share your time, your attention, your care with other people. Thank you for listening. I hope that you have a great day.